And thank you to all of you. I do not miss an opportunity to say that because I'm looking at friends here who helped deliver change to Washington. From the Oval Office on down to the Congress that is supporting the man that you put into the Oval Office to get some really big things done. Thank you for what you have already done. We'll talk about the challenges in a second, but those of you who care about the Constitution of the United States, those of you who care about our long tradition of acting responsibly abroad, those of you who care about a fair shake for Americans, those who care about smart economic policy, so much has already happened to get this country back on its feet again. And in the world that we are talking about, in the healthcare world, the big battle has yet to be fought, but so much has already happened. Think about it. It was just, what was it, 2 or 3 years ago that the President of the United States said, we don't have an access problem. If you don't have insurance, you just go to an emergency room. Showing the degree of knowledge and competence and commitment that that administration had to making progress on this issue, which is so essential, not just to us as economic individuals, but to us as moral individuals. Because the system that we now, the so-called system that we now have, is a moral embarrassment, and it's an economic liability. And we've known for a long time that it's a moral embarrassment. We hear the figure so often that we're desensitized to it. 47 million Americans without health insurance. What we don't hear so often is that 18,000 Americans die every year because they don't have access to our healthcare system. Think about that number, 18,000 Americans dying. Moral impossibility, moral embarrassment. What has become amply evident to everyone in Washington, and I do mean everyone, is that it is also a huge economic liability. Those who bother to get just beyond the headlines of what's going on in Detroit understand that there's a bunch of reasons why our auto companies are failing and why we're losing thousands of jobs associated with those businesses. The big reason is that the auto companies are carrying healthcare costs and liabilities that they simply cannot afford. Our small business people now, in the face of a very, very tough economy, are suffering because they can't. They have this terrible choice to make. We either cover the employees and we do the right thing, or we don't, and we have a shot at surviving. The system was never supposed to look that way, and as a result of this, I don't want to call it quite an agreement or a consensus, but this new awareness, things are moving. And while the war has yet to be fought, a couple of battles have been won. Twice, President George Bush vetoed S-chip, subsidized insurance to children who don't have access to the health care. Twice he vetoed it. And twice the United States Senate failed to stand up and to say, we're going to override the veto. We are going to force the opponents of health care for children to stand in the well of the United States Senate and explain themselves. Well, S-chip passed. There are now 11 million children in this country who have access to health insurance that didn't before. The Recovery Act, which of course was really not designed to specifically address health care, it was designed to stop this ridiculous world we live in where we're losing 20,000 jobs every single day. The Recovery Act actually probably did more to advance the cause of smart healthcare reform than anything we've done in decades. It contained billions of dollars to modernize and streamline, particularly electronic medical records, to try to take some costs out of the system on one extreme. On the other extreme, it provided for the subsidy to the tune of 65% of COBRA payments for people who've lost their job for a period of 9 months. So good things have happened. But of course, now the war remains to be fought. Here is what is happening. The President of the United States, as you know, said that we cannot fix the economy without fixing health care. And he said, I'm going to leave it largely to Congress to figure out what the actual, what a system of universal health care should look like. And he courageously, he didn't need to do this, but he said, despite the fact that I'm going to take a hammering over deficits for years to come, I'm going to put $600 billion into the budget because I'm going to be honest with people and say it doesn't come free. Now, what has happened on Capitol Hill is that there has been lots of discussion, lots of negotiation amongst very powerful committee chairs. And it is interesting to see because the new awareness we have of exactly how poorly served we are by this healthcare system, morally and economically, has led the insurance companies to say things like, we're willing to play on a field where we can't refuse to cover somebody for a pre-existing condition if Congress chooses to legislate that for all insurance companies. Now that's a good thing. It's also a tactical thing, because where Washington is going is the creation of a system where a public pool would exist side by side with private insurance companies. The public pool would be open to everybody. It would be competing on a level playing field, meaning nobody gets to turn down people with pre-existing conditions. And those who can't afford or who otherwise don't have health insurance are subsidized either into the public pool or whatever system they choose to employ. This is where the fight is. The fight in Washington right now is whether we should have a public pool, a public entity, or not. The Republicans are going to fight it tooth and nail, and they're going to fight it through their lobbyists and through some of the industry groups that will claim that it's not necessary. You'd need to spend about 5 minutes looking at the economics of the healthcare industry to understand that without a public pool, we cannot compete down the price of services in the way we need to compete down the price of services. To my way of thinking, the private insurance companies who spend vast sums of money around underwriting their potential clients, which of course is a fancy way of saying is figuring out who they don't want to cover, I don't understand actually why they don't embrace the ability to take that massive expenditure out of the cost structure. They'd be playing on a level playing field, and the public pool would be doing what the VA does and doing what the Medicare does, the Medicare system does, which is providing a baseline level of healthcare insurance, probably in a very efficient manner. The counter argument is they'll be competing unfairly, and it'll hurt us. Well, that it is not my obligation as an elected official to see to the profitability of private entities. It is my obligation to do whatever we can do to cover more people and to create a truly competitive system which does what exactly what competitive systems are designed to do, which is lower costs. Because we recognize, if we're honest with ourselves, and we must be honest with ourselves on this, that if we are going to cover all Americans, we must very substantially reduce costs in the system. And that's tough, folks. There probably are some easy things. We probably can reduce the amount of costs associated with underwriting, but it's also going to involve some tough, very, very tough decisions with respect to who gets what kind of care in this country. Morally, we will be far advanced relative to where we are today, but it is going to involve some very tough decisions. So I close with this thought. We are going to get this done. We will do it under reconciliation if necessary, because the Democrats are aligned on this and the President is aligned. For those of you who, and I can't even claim to fully understand the system myself, but reconciliation is a mechanism by which we will get this through Congress with only 50 votes in the Senate as opposed to 60 votes. We will get this done. The question is in what form and who is going to bear what cost. And the other side now has mobilized in a very, very big way. And so I leave you with this thought. The ringing criticism that people like me get is that you are spending out of control, you are piling debt upon your children and grandchildren, you are being utterly irresponsible. I must and you must, and this is my call to action, we must respond to say, no, 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 no. We are standing for our children and our grandchildren because we are not going to saddle them with a system that has destroyed the economy of the United States and made us morally culpable. We are going to deal with it. And yes, it is going to cost us some money. And setting aside the question of whether the other side has any standing at all to make arguments on the basis of fiscal responsibility, we are going to do it. Because the alternative is not to do it and to kick the can down the road once again for somebody else to deal with after there's been another series of years when 18,000 Americans have died every year. So please get out there and make the point. It's tough. Yes, we're spending a lot. Yes, the deficits will be very scary to look at out there, but unless we make these investments, unless we recalibrate this system, our economy is fundamentally damaged. We need to take the tough choices and do the things just as our grandparents and parents who fought World War II did. Make the sacrifices, take the tough choices to finally get this thing right. The battle is joined. It is now up to all of you to make sure that Washington hears loud and clear that now is the time to do this. Thank you very much.